Good evening, ladies and gentlemen, distinguished guests. Thank you so much for braving the unpredictable Geneva weather tonight. We're very glad to welcome you to this session organised by the IFPMA. So it's certainly been a bit of a roller coaster start to the year for global health, hasn't it? We've just seen the adoption of the pandemic treaty, which is historic, but we've also seen a fall in financing and overseas aid. So this is a timely event, I think, on ensuring that health remains a strategic priority. I'm Shuli Ghosh, and I'll be guiding us through this discussion as we explore how to maintain global commitment to improve healthcare for people right across the world, particularly in low-income countries, through leadership and collaboration, and how to continue to build an environment where scientific progress and advances in medical innovation can flourish. Because health isn't just about wellness, is it? It's about economic prosperity and security. It underpins social stability. It strengthens communities and nations. So in the next hour or so, we'll be examining the key enablers that drive progress in health. We have a fantastic panel of speakers who will be sharing their perspectives and their experience. And we'll also be inviting some of your thoughts and your observations on the state of global health as well. But let's start by hearing an overview of the current challenges and what's at stake. Please welcome the Director General of the IFPMA, David Reddy.
Thank you so much, Shirley, and thank you everyone for being here tonight. A warm welcome to you all. One thing that you're going to hear recurrently throughout this week are the two words change and challenge. And it would be an understatement to say this is a significant moment of change for the global health community. And what I want to do is, in the context of that global health community, just to convey that IFPMA, the companies that we represent and the associations we represent are all part of that global health community and very much feel a part of it. So tonight we're going to reflect on some of the challenges and I hope forge some alignment on what needs to be done. But I want to start by acknowledging the announcements made recently by the Director General of WHO on reform and some of the very difficult decisions that he and his leadership team have had to make to manage the current financial situation. Now, he's been very clear about what this means in some of his remarks, and just to capture a few of those, major structural realignment, that the WHO cannot do everything, and that the changes necessitate reducing the scale and scope of our work, to put it in his words. But he also said to use the current crisis as an opportunity for the organisation, and that's something that I think we all need to look to. Now, the WHO is a member state-driven organisation, and the discussions around what this will mean will continue throughout this week. And I think it's important to recognise that beyond the member states, this discussion has benefited from the voices of many partners from civil society, from industry, and many others. And as IFPMA represents the innovative pharmaceutical industry to the multilateral organisations and to WHO, it's just key to reiterate that our door is always open to engage in productive discussions. So beyond discussions, I just wanted to take a few moments to reflect on what our industry does and can contribute moving forward. So if you look at what the companies represented in this room have done, they're working to address some of the biggest healthcare challenges today and historically, particularly in the neglected tropical diseases. Some of the companies here are working to eliminate river blindness, schistosomiasis, Chagas, to reduce the burden of HIV, TB, and malaria. But there's also a lot of cross-company work, and examples of that include the Antimicrobial Resistance Action Fund that has been put together to really catalyse some of the R&D that's needed to bring forward the next generation of treatments to address resistance, and also Access Accelerated to address some of the challenges that are facing us in increasing access to the management of non-communicable diseases. Now, Is there a secret recipe to reframing this? Well, I think that, or to addressing this, I think part of it is to reframe our relationships, because I think that there is a lot more that industry can do, and I think we can work even more productively together. And so I just challenge, to some extent, for a shift in mindset from perhaps minimising the influence of industry to actually maximising the impact of what we can do within the frameworks of good governance and ethical business behaviour. And I think that's one thing to underscore as well, as IFPMA, one of our key roles is in industry ethics and our code of conduct. Now, what will really help us move ahead, I think, is to focus on the strengths that each partner can play. And it's clear that the core of what this industry can contribute is our research and development, quality manufacturing, and also increasing access through partnership, through working with others, because we can't do this alone. By 2035, we believe we could potentially deliver an additional 700 new medicines, and some of these could really transform the way we prevent and treat diseases. And we've seen some massive improvements even in recent years. But we have a shared responsibility to bring these forward. But this requires that healthcare continues to be prioritised by governments at a time where there are significant competing priorities, and we have to acknowledge that. Now, in the face of that, it may seem obvious, but we need to make and we need to remake the case for investing in healthcare. Now, the case for investment in healthcare is really the focus of our discussions this evening, and this is critical for three reasons. Because every person will face healthcare challenges throughout their lives. So it's the person centricity that is absolutely critical here. But it can also contribute to the growth of our economies if we get this right, and it's important for security. So I just wanted to bring in a few data points. I can never resist that. But in the last 50 years, vaccination has estimated to have saved around 150 million lives. Recent data suggests that adult immunisation programs could reap a 19-fold return on investment, which is substantial. And investing in health innovation over the next 20 years could save an additional 60 million lives and contribute around $12 trillion to GDP, which is an extraordinary amount of money. Now, there's an opportunity at the September UN General Assembly, because we're expected to, or we hope to agree, a political declaration on non-communicable diseases. This is an opportunity to really focus attention again on a key element of the health agenda and to make progress. And part of that will be continuing to ensure that healthcare is seen as a strategic investment by governments. Now, in that light, and in the light of healthcare, it's also, I think, important today more than ever to reflect on pandemic preparedness, because today we did see a historic milestone in the adoption of the pandemic treaty. Now, industry has engaged constructively to inform the negotiations. Sometimes it's difficult to bring forward some of the information in terms of what it really takes to have an environment that's conducive to innovation, etc., because there are often trade-offs to be made. But we feel that the case has been made strongly, and the current, the agreement is a starting point. It's not an end point, but it's the starting point for us to move together. And it is important that industry continues to be engaged in that process moving forward, because there is so much that we can contribute. We need to ensure that we focus on solving the challenges and that we don't inadvertently create new ones. Now, I think it's important to underscore also some basic principles that I think we all agree, and that is that the partnerships that will be core to this need to be respectful. They need to acknowledge the needs and the abilities of one another. Now, industry showed during COVID-19 the ability to contribute significantly to the innovation, the scientific challenges that were at hand. Industry also has needs, and that is in terms of our innovation model, It centres on strong intellectual property protection. And it's important to also bring that into the context of the discussions moving forward on the pandemic agreement. So, in conclusion, just to make a few final remarks, we are facing significant challenges today, but within this there are opportunities to do things better, but together, and to forge closer partnerships. So I'd challenge us to reframe the partnerships in a more open and solution-focused way, for each partner to deliver according to their strengths, to respect one another's needs, to assume and demonstrate positive intent to one another, and finally, to ensure accountability, all of us to be accountable for our action and for delivering on what we commit to. So I'm really looking forward to the discussions tonight, and again, thank you so much for attending.